Well, thank you so much, first of all, for inviting me and having me here. Excellent organization. So I'm going to actually not really talk about EMR because I'm going to start with a bold statement. And don't get mad at me, but I think in a few years, the traditional EMR that we call like basic level of healthcare digitalization will die because of AI. Because everything is happening so fast right now. So we need to do a lot of advancement, a lot of AI advancements, and a lot of integration, a lot of innovation to keep them alive, to keep them functional. So that's why I'm going to start the journey from where it first started. So I want you to, since this is a workshop, I don't want to just, deliver like a speech like that you might want skip ads button. So I want you to think through me, think with me. I want us here to imagine an utopia. So let's imagine a healthcare utopia. Healthcare, today's healthcare, cannot offer miracles yet. Why? Because at the core of it, there is human. And as His Excellency Minister said yesterday, right now we don't have healthcare, we have sick care. But it's not only in Pakistan, it's everywhere. It is how it has been all the time. Let's take a look at the numbers. So 74% of global deaths, according to WHO, World Health Organization, come from chronic diseases. Do you know how much percent of chronic diseases are actually preventable? Can you make a guess, like the percentage? Yes, exactly. 80% of chronic diseases are actually preventable, which means we really have the control of our own healthcare. And that's why we need to shift from sick care to healthcare. So where it all starts? Does it start with health data? Does it start with interoperability? Does it start with national healthcare systems? It starts with you. It starts with me. It starts with all of us. It starts with genetics. So I just, in my own way, I just try to explain how it was in the past and where we're going right now. So healthcare 1.0, which I call treat, okay? So we used to treat people only after they get sick. And this is like, when you think that, we didn't have antibiotics a century ago. It's a good step, it's a good step. Like when we look at the lifespan right now, we're doing great, but not enough. Hospitals were the temples and still are the temples of recovery, but not prevention. What His Excellency Minister said yesterday was like very, very important. He said that we're building all these hospitals, we're giving them the patient guarantees because we're relying on that people will get sick. But actually we need to find ways to keep people away from the hospitals. That's the real healthcare. And after that, this was the first step, healthcare 1.0. The healthcare 2.0 is track. So some countries, like my country, my home country, I'm actually coming from UAE, but I am from Turkey. We started this healthcare digitalization very early. In UAE, they are very advanced in healthcare digitalization as well. How we began? We began with, as we spoke today, since the morning, we began with connecting the data, telemedicine, EMR, HIE, national level, regional level, hospital level, patients' apps. So we started to connect them because we realized that data is such a power. But then we started to collect a lot of data. What we're going to do with all those data, We have data lakes, a lot of data, but how we can use them. So then we started tracking outside the hospitals as well. But again, mostly after the symptoms appeared. Like I am getting sick, I'm going to doctor, and they start to track me after the discharge, which is also okay. But we need to go beyond because we're still reacting, we're still reactive. So And lastly, we digitalize data, but the data that we digitalize is not for me. It's not for Eda. It's not for you, Zubia. It's not for you, Yavuz. Why? Because it's not for us. It's not personalized. It's generalized. So now we are living in an era, finally, that we're transforming all of it. What we do with the support of AI, we make the data understandable and useful and personalized. And where it all starts, if I should go back to my first slide, it starts with, I think, genomics. So first, in an ideal world, I think, imagine an utopia. What I need to do first, if you ask me, I need to know my code. I need to know my genomics. Because there are some things that I cannot change in my genetics, you know? So if I know about it, if I know my for example, the percentage of getting some chronic diseases, or my genetics to the chance, or let's say the possibility of getting cancer or any kind of serious illness, you know, then I can take preventions for that. So knowing the genomics. So now I know my genomics, now I know my own code and my data. What I should do with that? I should save myself, I should protect myself to not to get sick. That should be the first goal, to not to get sick, to not to go to hospital, to not to get sick. And I need to take the control of my own health data. How can I do it? Through wearables. Dr. Shafi in 2 days explained, like Oura Ring. I'm wearing Whoop. Some of you wear Apple Watch. It's important to track your health, and it's important, for example, the day before I came here, my Whoop bracelet was giving me an alert and saying that, hey, your recovery rate is low. So first, you need to avoid from heavy workouts, which I didn't. Secondly, you need to be hydrated a lot. Otherwise, you will get sick. If I wouldn't have that data, if I wouldn't have the power of that data, I will get sick right away. Right away. But now I can take preventions. This is a small level, but there are more broader, important experiences. And then we need to do routine checks. I don't know if you talk about it, but this month is, what is it? Breast Cancer Awareness Month, which is a serious cancer, right? So with the support of AI and preventative care, we can really, really avoid to get breast cancer. Who did this? Angelina Jolie, one of the most popular examples in the world. And she is now an advocate for breast cancer awareness because she was the first one who had a preventative surgery as an Hollywood star, which was a bold state. And then after discharge, we need to track the patients. So there, the remote patient monitoring and value-based healthcare comes. Because now we're still at volume-based healthcare. The hospitals, the doctors, the system, the insurers, they are paid depending on the volume, but not the quality of healthcare. So that's why the value-based healthcare is also very important. So, you know, we're just imagining an utopia. And then lastly, agentic AI to relieve the healthcare systems, to relieve the workload, etc. So, but how would it be? Eda, okay, you talked about some good things, but how realistic it is? How would it be? Why is it important? What is its impact? Let's calculate its impact together on Pakistan's healthcare system. Let's look at some baseline facts. Pakistan's population is approximately 255 million. And total annual deaths is around 1.67 million. These are the data of WHO 2024. The chronic disease share at these deaths are per year, let's say approximately 1 million. What does it mean? Every year, you're losing 1 million people because of chronic diseases. It's a huge number because 80% of those diseases are actually preventable. Premature mortality is also 26%, which is high. And the hospital bed density is, so basically what it means is that per 1,000 patients, there is just one hospital bed. So even if you would want to go to hospital, if you're in urban areas, then like you might not go, you know? So that's why, how can I go back? Okay. So I made a calculation, but I'm not a statistic authority, but made a calculation. If we could have applied all the changes I just summarized, from genomics to preventative care, longevity, and healthcare digitalization, how would it affect us today? So for chronic diseases, I calculated it with 3 scenarios: more conservative, moderate, and very ambitious. So let's look at the ambitious ones, because I want us to be ambitious. So if we could apply those changes in our healthcare system, every year we could have saved at least 300,000 people's life just from chronic diseases. 300,000 people's life. Emergency care visits could have been decreased at least 30%. Hospital admissions could have been decreased at least 15%. Readmissions regarding chronic diseases could have been decreased 25%. And bed days could have been 96,000 beds could have been freed for more serious cases, for more emergency cases. So at least in an, I would say, conservative scenario, at least 100,000 people's lives could have been saved every year with all this digitalization. And even a 10% prevention gain. So imagine if we could have increased this prevention rate. How we could do that? We could have do it through virtual first care, because primary care is, as His Excellency Minister said as well, is one of the pain points of the healthcare system. We should definitely strengthen the primary care. AI monitoring can relieve tens of thousands of bad days, and the capacity should have been much more relieved, much more comfortable. And if you think that, Eda, you're just imagining an utopia, but this is not realistic. No, because you can take a look at all the resources I'm sharing here, WHO Global Health Observatory, and all the reports here, that these results are not futuristic, because in developed countries, they are happening right now, and they're doing it, and they shown similar impacts. So what we should do, we should go beyond. We should go beyond EMR. We should go beyond healthcare information management systems. We should go beyond digitalization. We have a lot of data. We are getting a lot of data. We know how to get data, how we can make it connected, intelligent, and preventative. We can do it together. And I want really the prevention to be the next prescription, because I don't want to get more drugs. I don't want to go to hospitals more. It's not cost efficient, it's not hygienic, and it's not also, you know, who wants to go to hospital so often, right? So I really want prevention to be the next prescription. Thank you for listening to me. Thank you.